Cyclone Yas makes landfall, crosses Odisha coast and is likely to reach Jharkhand tomorrow morning. Nation better prepared to defend itself from COVID pandemic, says Prime Minister Modi. Assam Cabinet takes key decisions on administrative reforms in state. Assam government notifies black fungus as an epidemic disease. And Meghalaya Chief Minister Conrad Sangma reviews installation of oxygen generation plants in 2 Shillong hospitals. A very good evening, viewers. Welcome to the Northeast News Bulletin from the studios of DDK Guwahati. This is Sangeeta Bhattacharjee. Now the stories in detail. Cyclone Yas has made the landfall and has crossed the Odisha coast south of Balasore as a very severe cyclonic storm, and it is expected to reach Jharkhand tomorrow morning. Talking to Director General, India Meteorological Department, IMD Mrityunjay Mohapatra said heavy to extremely heavy rainfall will continue to batter Odisha through the day. He said West Bengal, Sikkim, Bihar and Jharkhand are likely to witness heavy to very heavy rainfall today and tomorrow. Extending his greetings to the people of the country on the occasion of Buddha Purnima, President Ramnath Kovind said the teachings of Lord Buddha show us the path to liberation. The President urged the people to follow the path of wisdom, compassion and service shown by the Buddha and get rid of COVID-19 through collective and concerted efforts. In his message, Vice President M. Venkaiah Naidu said Lord Buddha's eternal message of peace, brotherhood and compassion continues to inspire humanity across the globe. Buddha Jayanti is commemorated by Buddhists and Hindus all over the world. It is a major festival in nations like India, Nepal, Bhutan, Myanmar, Thailand, Tibet and China, among others. Asserting that the nation is better prepared to face the onslaught unleashed by the COVID pandemic, Prime Minister Modi said better strategies against the virus have evolved over a period of time. Delivering his keynote address on the occasion of virtual Vesak global celebration through video conferencing on Buddha Purnima today, Prime Minister Modi said the nation now has vaccines which are key to saving lives and defeating the pandemic. The Prime Minister lauded the efforts of scientists who worked on the COVID-19 vaccines and extended his gratitude to all frontline and health workers, doctors and nurses who selflessly risk their lives to serve others in need. Modi remarked that this once-in-a-lifetime pandemic has brought tragedy and suffering at the doorsteps of many and hit many nations, even as he condoled the dead. The event was organized by the Culture Ministry in collaboration with the International Buddhist Confederation. The Assam Cabinet meet chaired by Chief Minister Dr. Himanta Biswa Sharma today took key decisions to initiate administrative reforms in the state. A new separate department named Welfare of Bodoland Department has been created today. Early on, it was under the Welfare of Plain Tribes and Backwards Classes. Further, the Bodoland Administrative Staff College would be set up at Kokrajhar. The Cabinet further decided that no file will have to be sent to the Finance Department seeking ceiling for Kuhal Kuor Universal Old Age Pension and Deen Dayal Divyang Yojana. The senior-most secretary of the concerned department will be empowered to release through DBT to beneficiaries. The Cabinet observed 2-minute silence mourning the demise of Gosaigaon MLA Majendra Narzari. The Assam government has declared black fungus, medically termed mucormycosis, as a disease under Section 2 of the Epidemic Diseases Act 1997. It's now incumbent on government and private health facilities and medical colleges to follow screening, diagnosis and management of mucormycosis. There are existing guidelines issued by the Ministry of Health and Family Welfare, Government of India in this regard. Centre has allocated over 72,000 vials of antifungal drug amphotericin B to all states and union territories in a span of just 5 days. Union Chemicals and Fertilizers Minister Sadanand Gowda has informed that the government is committed towards ramping up the production of antifungal drug to meet all requirements. He said 29,250 vials of amphotericin B has been allocated today to the states and the UTs looking at the increased demand. Earlier, the Central Chemicals Ministry had ensured quick and timely allocation of nearly 1 crore vials of remdesivir in the country to tackle the COVID surge in last 1 month. India has crossed 20 crore cumulative COVID-19 vaccination coverage today. India achieved this milestone in 130 days since the start of the vaccination drive. The vaccination coverage crossed the 20 crore mark with 20 crore 6,62,456 doses, including over 15 crore 71 lakh first dose and over 4 crore 35 lakh second dose of vaccines. Health Ministry said over 34% population above 45 years has received at least first dose of COVID-19 vaccine in India till date. Similarly, over 42% of above 60 years of population in India has received at least first dose of COVID-19 vaccine. India is the second country after the US to achieve this coverage in just 130 days. The US took 124 days to reach the 20 crore mark. Other leading countries in vaccination drive include the UK, which has reached 5.1 crore mark in 168 days, Brazil that reached 5.9 crore mark in 128 days, and Germany, which reached 4.5 crore mark in 149 days. India's daily COVID recoveries continue to outnumber the daily new cases for the 13th consecutive day. Over 2.95 lakh patients have recovered from coronavirus disease within 24 hours. The recovery rate has further improved to 89.66% in the country. So far, over 2.43 crore patients have already recovered from this infectious disease. The Health and Family Welfare Ministry has said the country is registering a significant decline in active caseloads amid the second wave of COVID-19 pandemic. The active caseloads comprises 9.18% of the cumulative position cases, and it is continuously declining. It said the country has registered a decrease of over 91,000 active cases in the last 24 hours. At present, there are over 24 lakh active cases in the country. In the COVID scenario in the northeast, Arunachal Pradesh has reported a caseload of 3,323 active cases, followed by 21,575 discharge cases. Tally for the dead is 104. Reporting 53,541 active cases, Assam has a count of 3,23,368 released cases, even as the dead tally 2,915. Manipur has a count of 6,785 active cases, while the cured cases number 37,946. The death toll is 720. Reporting 7,971 active cases, Meghalaya has notched 22,976 discharge cases. The dead account for 502. Representing a caseload of 4,806 active cases, Nagaland has topped 15,414 released cases, even as the dead tally 315. Reporting 3,370 active cases, Sikkim has a caseload of 9,904 discharge cases, even as the dead account for 237. Tripura has 8,001 active cases, followed by 39,491 released cases. The tally for the dead is 473. Meghalaya Chief Minister Conrad K. Sangma on Tuesday visited two hospitals in the city, Ganesh Das Hospital and RP Chest TB Hospital, to review the installation of oxygen generation plants. The Chief Minister informed that the oxygen plant at Ganesh Das will likely be operational in the next 24 hours, and in the next 48 hours, the RP Chest TB Hospital's oxygen plant should be up and running. The 400 LPM oxygen plant at Ganesh Das Hospital will support a minimum of 40 beds with high flow oxygen and is expandable up to 100 beds. The 300 LPM oxygen plant at RP Chest Hospital is being funded under the PM CARES and can support a minimum of 30 beds with high flow oxygen.
Keeping a close watch to ensure that these are completed before time, as the situation requires that we have all our infrastructure ready and in place in any eventuality.
Manipur Chief Minister N. Biren Singh inaugurated the PSA oxygen plant with a capacity of filling 45 to 50 D-type cylinders a day at Churachandpur. This is being seen as a significant addition to the existing production capacity in the state, the Chief Minister said in a tweet. Meanwhile, inaugurating the integrated Ayush Hospital and COVID Care Centre with 200 beds and oxygen concentrators at K. Rao in Imphal East, and Biren Singh tweeted that the facility would cut the load in other existing facilities. The Meghalaya government on Monday decided to revive the Essential Kits initiative for COVID patients who are under home isolation. It may be mentioned that during the first wave last year, Meghalaya Deputy Chief Minister Preston Tingson said that the government had provided essential items for those persons under home isolation. Furthermore, he informed that the government has adopted the policy of micro-containment in villages, households and localities given the surge of COVID cases. The government will also create more corona care centres, and if the positive patients want to stay at these centres, they can do so, Tingson added.
More corona care centres as much as possible, because these people ultimately who were there in their respective isolation household or whatever, if we have enough space, I think we will take them out and we'll bring them to Corona Care Center.
At the Asian Championships, seasoned Indian boxer Shiva Thapa secured his 5th successive medal by advancing to the semi-finals after outpunching Kuwait's Nadir Oda 5-0 in the men's 64 kg in the last 8 stage in Dubai on Tuesday. The Assam boxer Thapa prevailed in a lopsided clash to set up a showdown with the defending champion and top seed Bahadur Uzmonov of Tajikistan. In Asian Boxing Championship, 5 Indians, including 3 women, advanced to the semi-finals with impressive victories as India's assured medal tally rose to 12 in the Asian Championships. Sanjeet Sakshi, Jasmine and the Olympic-bound Simranjit Kaur joined Shiva Thapa in the last 4 state following their wins in their quarter-final bouts last night. They added to the 7 medals, including that of 6-time world champion MC Mary Kom, that were assured on the day of draws. And to end the news, the main points once again. Cyclone Yas makes landfall, crosses Odisha coast and is likely to reach Jharkhand tomorrow morning. Nation better prepared to defend itself from COVID pandemic, says Prime Minister Modi. Assam Cabinet takes key decisions on administrative reforms in state. Assam government notifies black fungus as an epidemic disease. And Meghalaya Chief Minister Conrad Sangma reviews installation of oxygen generation plants in 2 Shillong hospitals. Before taking leave, viewers are reminded to maintain physical distancing, regularly sanitize hands and frequently wash hands with soap. Remember to wear a mask properly and join the Mask Up India campaign by Doordarshan to defeat the pandemic. Mask Up India. That brings us to the end of this evening's bulletin. Thank you for tuning in. Namaskar.